little bit more time. Well, good afternoon, everyone. I'm Kayhan Parsi, and I'm an associate editor for the American Journal of Bioethics and a professor of bioethics at the Nice-Wenger Institute for Bioethics at Loyola University Chicago, Stritch School of Medicine. I wanted to welcome you all to the first ever AJOB webinar. The title of today's webinar is Black Bioethics, Racism, Police Brutality, and What It Means for Black Health. We're fortunate to have an amazing panel to discuss today's topic. AJOB and Bioethics.net is dedicated to exploring a variety of issues in the field of bioethics. The idea behind today's webinar originated with our editor-in-chief, David Magnus, who wrote a blog on police brutality. His piece is listed among many other valuable resources in a toolkit on bioethics and race that Craig Klugman and Keisha Ray developed for Bioethics.net. I encourage you all to visit our site. I also wanted to acknowledge the efforts of Bella Fishbein, who is our executive editor of AJOB, and Megan Zidanovich, who is the interim executive editor, as well as Dr. Ray, in planning and promoting today's webinar. The recording will be posted on bioethics.net. Now I'd just like to introduce our panelists. First of all, we have Dr. Keisha Ray. Keisha Ray, PhD, received her PhD in philosophy from the University of Utah, and is currently an assistant professor with the McGovern Center for Humanities and Ethics at the University of Texas Health Science Center at Houston. Most of Dr. Ray's work focuses on the social determinants of racial disparities in health and healthcare, and incorporating race education into medical school curricula. She's contributed to peer-reviewed journals, edited volumes and textbooks, and currently has 2 monographs in progress on racial disparities in health. Dr. Ray serves as associate editor of the American Journal of Bioethics blog site, to which she's a regular contributor. Next, we have Patrick Smith, MDiv PhD, who is an associate research professor of theological ethics and bioethics, as well as senior fellow, Kenan Institute for Ethics at Duke University. Trained as a philosopher, his area of focus is in theological ethics and bioethics. Professor Smith is also associate faculty with the Trent Center for Bioethics, Humanities, and History of Medicine at Duke University School of Medicine. He has specific academic interest in the relationship of bioethics and social ethics. And then next we have Ruqaiijah Yearby, JD, MPH. She's a professor of law, executive director, and co-founder of the Institute for Healing Justice and Equity at St. Louis University. Professor Yearby is a specialist in racial disparities in healthcare, the impact of employment on health, and social justice in medical research. Due to her expertise in justice and medical research, she presented her work at the 2016 at the Oxford Global Health and Bioethics International Conference in Oxford, England. She's dedicated her career to improving the lives of vulnerable populations by addressing the lack of equal access to quality healthcare. And then finally, we have Dr. Brian Williams. Brian Williams, MD, is an associate professor of trauma and acute care surgery at the University of Chicago. Dr. Williams led the trauma team that treated police officers ambushed by a sniper on July 7, 2016, the largest loss of life for U.S. law enforcement since 9/11. Recognizing his many community contributions, Dallas Mayor Rawlings appointed him in 2017 as chair of the Dallas Citizens Police Review Board. In addition to being an academic surgeon, Dr. Williams is a renowned keynote speaker, a guest opinion writer featured in the Chicago Tribune and Dallas Morning News, and hosts the podcast Race, Violence, and Medicine. So welcome everyone, and I'm delighted to have you all join us today for this first ever webinar. And I just wanted to start off with this question. It may be hard to believe, but as of today, July 14th, it's been exactly 50 days since Derek Chauvin, a white Minneapolis police officer, killed George Floyd. So I just wanted you all to kind of reflect on what's happened in these past 50 days. What surprised you, what's disappointed you, what's encouraged you, and I'll start off with Dr. Ray.
Thanks, Kayhan. I will say what I'm most surprised by and encouraged by is the just how all-encompassing the Black Lives Matter movement has been, the conversations that people are having about Black lives beyond police brutality, right? I'm really, really glad that we're starting to have these conversations about what police systems, what police brutality what it means for Black people specifically, what it means for Black health specifically. But I'm glad that people are having these conversations about racism and white supremacy and their far-reaching effects outside of police systems, right? If you're like me, you've probably gotten an email saying we support Black Lives Matter from any company that you've probably ever bought anything from shoes to sofas or, you know, whatever. And so you're starting to see that it's sort of reaching these other places. And other than not just businesses, but I'm really glad that these conversations are happening in health, because health and well-being, as you know, are just so essential to us. And so I'm glad that these conversations about racism, white supremacy is really extending into healthcare. And we're asking these questions about what does it mean when we systematically withhold health and well-being from Black people? What does it mean for their life? What does it mean for the future generations, for their children and their families? And so I'm really excited, and I feel really, really rejuvenated by the fact that these conversations are not just about police brutality, but are about racial disparities in healthcare, racial disparities in business, racial disparities in TV and media. So I've been really encouraged by that. I will say though, speaking back to all of these emails that we've all received from various companies, I'm a little disappointed that we haven't seen these sort of plans for action, right? You see the emails and they say, you know, we care about Black lives. And what I want to know is, okay, now what is the plan? Show me that you care about Black lives. Don't just say it. What is your plan of action? Show us that you care about your customers and your employees that are Black. Show us what your plan of action is. Show us the racial makeup of your board of directors. Show us what you're doing to uplift Black voices and to put them into positions of power and to dismantle white supremacist structures that keep Black people out of various enterprises like healthcare, business, media, banking, housing, government. So I want to see more of the plan of action. You know, what are we actually going to do?
Thank you. Dr. Smith, any additional thoughts about that?
Yeah, I stand in many respects with Dr. Ray's comments and reflections on this score, and I have been very pleased and surprised to see the widespread response from a number of different groups in this situation that did not seem to be present with some earlier incidents that gained national attention. It's unfortunate that it takes situations like this to raise attention to these issues that many have been sounding off on for decades in many respects. I come from a particular tradition that says, you know, you continue to bear witness against the odds, right? That what you think is correct, that what you see is true, that what you see is right, continue to bear witness to that. And so I am, I think, encouraged to see a kind of response after years of many people laying their bodies on the line, their well-being on the line, to bear witness to some very important issues that our country has to wrestle with and reckon with.
Professor Yearby, any thoughts from your perspective as a law professor and a legal scholar?
Yes, so I would say that I find it positive that in response to a lot of the protests that you see counties, cities, school boards passing either proclamations or laws that say racism is a public health crisis. There was only about 2 of those prior to this incident, and actually prior to COVID-19, and every day now you see people discussing this and really moving forward. I think the problem for me, however, goes back to something that Dr. Ray said, which is plans. Lots of companies have said that they are supporting racial equity, but I haven't seen them come forward and say, we're going to post our wage data to ensure that racial and ethnic minorities, that women are paid the same as others. When we look at England, they have already made that data publicly available based on gender and race, and we have not done that. Actually, corporations continue to fight, and the government has decided not to collect this information. And so I think that is very important if we're going to say that we're going to address racial disparities around income inequality. I would finally say for me, in terms of the legal system, that I would hope that we would make changes to the legal system. I think oftentimes we look at policing as something separate from the problems, the inherent hierarchy and structural racism and discrimination that is a part of the legal system. And we really haven't begun to talk about those issues, about why are we policing people in this way? Why are there crimes that we're enforcing in a way that leads to somebody's death? So I'll stop there, but I think we have more to do. And what I hope is that if we're going to move forward to change, that it actually results in some structural change, particularly around employment, wages, and how our legal system treats people who are poor, Black, Latino, Native American, and women, and all the other vulnerable groups.
Dr. Williams, what are your reflections over the last 50 days as a trauma surgeon?
I'm very encouraged by the breadth of the voices that are speaking out now, particularly as a healthcare professional, and seeing how this is pushed the discussion about what it means as far as medical education and talking about the legacy of racism in this country and in our education, and seeing how healthcare intersects with so many other segments of our society and what that means for us as professionals and how we can become advocates and activists to improve the society for all outside of our trained specialties. So to see that energy, to see that discussion happening, it's encouraging, and I actually feel the energy. But also, you know, I'm holding back because it's really easy for us to, you know, raise our fists and march when we're in a crowd, but to be the one that's out front and leading that change, that takes another level of courage. And that's what I want to see happen, is that we continue to push this and not let this energy wane as the weeks and months pass.
So the next couple of questions I want to combine because I think they're linked. So one is, why is police violence even a bioethics issue? Because people that come from traditional bioethics may not even see this as a bioethics issue. And then how does modern day policing affect the health of Black individuals in this country specifically? So perhaps Dr. Ray, you want to take a stab at that one?
Yeah. So first I'll talk about, I guess, why is it a bioethics issue? As someone who, from the very beginning of my bioethics career, work has been questioned as whether it's a legitimate topic of bioethics. I've been really thinking about this question a lot as I have conversations with fellow bioethics friends, and you know, we're thinking through these topics and what can we do as a profession. We all know that bioethics is a very principlist discipline, right? We have these principles that we follow, and one of those is justice. Another one is respect for persons. And I think it also, in some direct and indirect ways, is also about upholding or uplifting the value of humanity. And, you know, we all have different approaches to these topics, but I think we can all agree that that's at least something that we focus on. And any threat to dignity and humanity of people, any threat to justice, any threat to respect for persons ought to be something that we condemn, something that we study, something that we research, and something that we work against, or something that we work to dismantle. And so police brutality is an antithesis to all of those things: respect for life, respect for persons, and justice. And so I think that when we're confronted with these threats to humanity, particularly when it's for certain groups, that should encourage us even more to be outspoken, to take these stances against these topics, against these happenings, and to become advocates. And I think advocacy is a big part of bioethics. So I think talks like this, and committing actual plans of action, is something that bioethicists should be a part of. And also, if bioethics is about the health of humans, police brutality is a direct threat to the health of individuals who experience it, the people who watch it, the videos of social media. It's also a threat to future generations of Black people, right? We have this thing researchers call racial hypervigilance, right? where Black people, other people of color are always aware of their race and always aware of how other people interact with them because of their race, whether that's being followed around in a store because of their race, or whether that's being denied a home loan application because of their race. And so this racial hypervigilance is not good for our social health, our psychological health, or our biological health, right? To be under constant racial stress. And so I think racial hypervigilance is something that we really have to think about as this connection between police brutality, unjust systems, and Black health. It's again, it's not that race makes a person have poor health. It's the effects of race. It's racism. And so I think police brutality is a part of that system of racism that makes it bad for Black to be bad for health.
And I've written that bioethics has been kind of a Johnny-come-lately to the issue of bioethics. And I've pointed to other fields such as public health, and perhaps Professor Yearby, you can talk to this. Do you think other fields such as public health have done a more effective job of addressing issues such as race, especially systemic racism, and that bioethics is kind of catching up? Or what can bioethics learn from other disciplines with regards to this issue?
I would say that, speaking quite frankly from a law perspective and public health, that none has done a great job of really centering racism and structural racism and linking it to differential outcomes for people. When I say structural racism, I mean the ways that our system have been structured to produce differential conditions between whites and racial and ethnic minorities. And it can be structural discrimination, right? That includes women, disabled, the poor. In public health, we mention the social determinants of health, but we do not ground it back into the root causes. We talk about that there are differential conditions. We might talk about residential segregation or other areas, but we don't bring it back to the structures, to discussing how the structures are set up to disadvantage people. And so that causes a lot of stress, as Dr. Ray mentioned, right? Because you're hypervigilant, you're always worried about racism impacting you, but then you also blame yourselves. I think that when we look at COVID-19, you can see this playing out quite clearly, in the sense that, you know, we began to talk about that there are racial and ethnic disparities in COVID-19 infections and deaths. And here you have public health officials beginning to blame African Americans and Latinos for actually suffering. And I think you can see this in the legal system as well, that we often blame the victims and not hold the perpetrators accountable. And so yes, racism has been discussed in the law, it has been discussed in public health, but it's never grounded in a sense of we need to change the structures that actually produce these outcomes. And so what can bioethics learn is that when we begin to talk about ways that we need to inform justice discussion, respect for persons, that we need to ground it in these are structures that we need to change and not blame people who are victims of it, and really begin to talk about how do we change these structures to accomplish justice, equity, and fairness.
So Dr. Smith, what are your thoughts? What can bioethics bring to the table with this kind of issue with regards to police violence, structural racism, these kind of systemic issues?
Yeah, I think that some of my work has really been interested in bringing together some of the values, the virtues, the insights from social ethics in general, religious social ethics in particular, to these questions of bioethics. Colleague, Dr. Galerno from Harvard Medical School, she's written a lot about communities, right, the importance of communities and the bifurcation that we have sometimes between clinical ethics and public health ethics. Well, many of us recognize that in some ways that could be a bit of a false dichotomy. Yes, there are insights with regard to each of those that need to be uplifted in some ways, but we have to recognize that people are interconnected and interdependent in such deeply intricate ways that we have to be careful that our ethical frameworks don't create a kind of artificiality that does not reflect the embodied, lived, material experiences of human beings. And so this is where many traditions and other ethical approaches have tried to start from below, so to speak, to look at the lived material conditions of where people are, have a particular kind of vision of where we need to be and where we want to go, and then try to recognize the means that can help us best accomplish those given ends. And so these notions of solidarity, or as Dr. Ray said earlier, how do we think about questions of human dignity, the role of justice? I think recapturing the virtue of the love as a political virtue, right? Not in some type of squishy sentimentalist understanding of that, but as a genuine political virtue that's connected deeply to this notion of justice. So we think about police violence and the stress that it causes on certain communities when they have encounters with other individuals becomes really important. We think about at times some of our hospitals, they have police officers who are in those spaces, who have their uniform, who have their guns, and there may be good reasons for that presence. But what does that suggest when you have people from particular communities coming into these spaces that already have a sordid history, sometimes with healthcare, and maybe even with law enforcement in some ways, and all of these things come together? And so the last point I would just make is that I do think there is the reason why these issues come together, because it's the same, I would say, underlying social pathology that permeates all of this, right? And it's this whole idea of the racialized imagination, right? Reality is that if we live in the United States, we have all been racialized, whether we like it or not, right? We have all been identified in particular ways with particular perceived social hierarchies. It informs how we view each other, how we include each other, how we exclude each other, how we shape our social arrangements, right? So there's no way that we can avoid the fact that we have all been racialized, which gives rise to this notion of a racialized imagination that puts certain groups at the top of the kind of social hierarchy in particular ways. And so I do think the racialized imagination continues to rear its head, even when we deal with the symptoms of it in certain respects. It continues to reemerge and evolve in different ways because we haven't, I think, rooted out this notion of the racialized imagination, such that bioethics, I think, thinking about police violence and the negative health outcomes that has on people and communities of color, that if we wrestle with these issues, perhaps we can make even more progress in some of these discussions.
Dr. Williams, I wanted to address the next couple of questions to you because of your experience in Dallas with the police board. So these two questions, again, I'm going to group together. So we often hear in the popular press that officers like Derek Chauvin are bad apples. And we hear repeatedly that kind of trope of the bad apple theory, even though that we know that systemic racism permeates a number of our institutions, including the police. And Seth Stoughton, who's a former police officer and a law professor at the University of South Carolina, he said something recently. He said, we don't have a race issue in policing, we have a race issue in society that gets reflected enough and magnified on police encounters. And I was wondering what your thoughts are in response to Professor Stoughton's view on policing, and perhaps bringing in some of your experience on the Dallas Police Board.
Yeah, so I'll unpack the professor's statement, and you're correct. I'm coming at this through the lens of a trauma surgeon, a doctor, and all the ethical obligations I have to my patients, but also as a chairman of the board, or former chairman, what I learned interacting with police officers, particularly command level police officers who also have an ethical obligation to their communities. And what binds us both is that as a doctor and as law enforcement, we have a certain degree of power over individuals who are either less educated than us. They come to us and they're sick, they expect me to help them. As a law enforcement officer, you have the backing of the law and the state to execute certain duties. So there are vulnerable communities because of that reality. And ethically, we have an obligation to serve humanity somehow. And I criticize healthcare for its systemic racism and the legacy of racism within healthcare, particularly exploitation of racial and ethnic minorities throughout the history of medicine. But we can also talk about policing as well and recognize that police departments have existed for a large part of this country, for a large segment of this country, in order to contain and restrict racial and ethnic minority groups, not necessarily uplift those groups, right? And that is the history And once we address that, we can talk about progress moving forward. The same way we're having that discussion in healthcare now about how healthcare has its own issues with systemic racism and implicit bias. You can acknowledge the history. You can still be supportive of the police. You can back the blue and still criticize, talk about what can be improved. And when it comes down to ethics, this is about our shared humanity. And that is something we need to address to move forward.
I'm glad you brought up history, because I feel like we treat these issues ahistorically, whether it's the policy level or whether it's within our own fields. And my next question deals with this issue, and I'm glad you brought it up, that scholars such as Khalil Gibran Muhammad, he stated in a recent NPR interview about the history of policing in this country and how it was rooted in slave patrols. And he said that that was the dominant form of law enforcement for many, many years and a good part of this country's history. So I just want to get your thoughts about this history, and how does the history inform where we are now with regards to not just policing, but these systemic issues. I want to kind of go back to something that Professor Yearby mentioned about segregation, because it seems that that is a social determinant that overdetermines so much of our health in this country. We've read that one zip code says a lot about your health status. And so I was wondering if you all can kind of talk a little bit about the history of systemic racism, but also how things like segregation contribute to what we see now with regards to issues of access to healthcare, having law enforcement seen as an oppressive force as opposed to a group of professionals that serve the interests of humanity. So I'll throw it out there. Perhaps Dr. Ray, you want to take that?
Sure. So I think the part of your question sort of threefold. The one part that I want to make very clear is that something that Dr. Yearby said about segregation, and what's really, really important to think about the social determinants of health and the social influences on our health. When we talk about segregation, we also have to talk about the nature of housing, right? Other than race, where we live, like you said, zip codes has so much influence on our health. The safety of our neighborhoods, if there's recreation areas in our neighborhoods, if our neighborhoods provide adequate heating and cooling in our homes, if we feel safe, or are we hypervigilant because we're worried about crime and protecting our children in our home, if there's access to pharmacies nearby and to grocery stores that have good healthy food, is there access to clean water and clean air, is there a landfill nearby? And a lot of what we find is that the kind of housing that we can expect to find in predominantly Black neighborhoods is not conducive to good health. So a lot, in particular, environmental injustices, right? We think about where landfills are built. We think about what areas have the most air pollutants and the most carcinogens. It is neighborhoods predominantly populated by Black people, or near schools predominantly populated by Black children. So there's already this disparity that's happening in housing that then affects their health. If you live in an area such as Cancer Alley in Louisiana or in Mississippi, where they have 5 times the rates of cancer and they're predominantly Black neighborhoods, you are going to see differences in cancer rates for Black people, right? If you have schools mostly populated by Black children and they're near highways that have pollutions, or they're near landfills, and then we start talking about differences in asthma among Black children, particularly Black boys, you see the connection. You can't talk about Black health and the disparities in Black health if you don't start to talk about the history that put Black people in certain neighborhoods or put Black people living near pollutants. So I'm glad that this conversation about police brutality has sort of opened up and expanded this conversation about social determinants of health. One, because that's the area I work in, so I'm glad people are paying attention, but also it's starting to open up this conversation about the historical connection, like you said, with police force. We can't talk about police brutality if we don't talk about the history of police and how history tells us that police were never there to safeguard the health or the freedom for Black people. That was not their intention. The same thing with housing. Housing was never meant to make sure that Black people lived in safe neighborhoods. It was to keep Black people out of white neighborhoods or out of the safe and wealthy neighborhoods. So I'm really glad that you brought up this historical dimension, because we can't talk about where we are now with Black health if we don't all talk about the origins.
Kayhan, can I add to that?
Yeah, go ahead.
What she's saying, like, those were intentional policies. There was no accident where all of these neighborhoods were placed, and that persists to this day. And the connection with policing, I think about 5% of all police calls are actually responses to violent crimes. The majority of the work that they're doing is a response to all these other social issues that they're being asked to address. Now, imagine if we took the energy and money that was put into isolating Black people, brown people from the rest of society and made efforts to radically include them into mainstream society, how that would reduce all these issues that we're talking about in regards to inequity in healthcare and economic opportunity in education. And probably that will lead to a dramatic decrease in crime and less need for policing, less police brutality. It's not a utopic vision. It seems to make absolute sense, right? So let's talk about doing that, radical inclusion for groups that we've always excluded from society.
Yeah, that was interesting what you said, that the structures that we've inherited are not by accident, right? They were done, intentionally created for a specific purpose. And I had my students read Pathologies of Power by Paul Farmer, and he has a quote in there that's something like, what's the definition of a liberal? Someone who thinks that all bad things happen because of accidents. Well, he said, that's not, bad things happen because that was the intent. The structures have created these bad effects. So we can recreate the structures, right? We
Right.
have that in our power.
Hey, can I
Go ahead, please. Yeah, jump in.
Yeah, because I think this is so important with this historical connection, just to underscore this point of housing, right? And there's a long history about how our social arrangements have come to be. And a lot of people are sometimes surprised when they learn that ghettos just don't happen, right? As Dr. Williams was saying, you think about, whether it be like the Mexican repatriation, responses, or what was going on with Native Americans being brought off of their lands, trying to be assimilated into some of these urban environments. You think about the Great Migration, where Black folks were fleeing racial terror to the north, only to be confronted with laws, right, that said they can only live in certain areas. And these were areas that were already impoverished, with poor housing already established. So Black people in these situations were already poorer than their counterparts. Then they were relegated to these really dense, dilapidated areas that needed housing updated, but they did not have the money to be able to afford those kinds of things. Then you see this kind of reinforcing effect that was taking place with respect to housing. And people can look and say, see, our neighborhoods, our communities are better without these particular individuals being in it. It becomes another way of blaming those individuals for these conditions and these situations when these were kind of foisted upon them in many respects. And it's just a real insidious circle and cycle sometimes that often is represented by these kinds of issues. And it goes back again to this idea, I think, of the racialized imagination that is shot through this. And when I was working in New England, working with a community development corporation, dealing with bringing affordable housing to certain areas, I continued to see this firsthand, where people were so resistant to particular groups coming into their communities, because even if they wouldn't utter it, the idea was that we will be better without them being here. And this is 2018, 2016, 2017.
Yes, I want to jump in to
yeah,
say,
please go ahead, Professor Yearby.
when we look at this, how do we accomplish it? We often accomplish it through law. And I think the problem is that we accomplish it often through neutral laws and policies that allow us to continue this process, right? And so when we think of residential segregation, it was pretty clear. Sometimes though neutral in the sense to say, yes, everybody can have housing, but we're not going to insure any loans that go to Blacks. We fast forward to the mortgage crisis with all the practices that were done to go after Black, Latino, and poor people, again, losing their housing, but never getting restored back to the place that they are. And when you look at COVID-19, so many people are being evicted, and we're just at the top or beginning of another mortgage crisis where people are not going to be able to stay in their homes. But I want to highlight something I think that hasn't been discussed, and probably because it's my area too, is that it's the same thing when we look at employment, right? When we look back to the New Deal and the Jim Crow era, the same time, you see lots of people who are now essential workers not covered under paid sick leave, not protected and provided with the federal minimum wage or overtime pay or workers' comp. And those are poor people, Black and brown people, women who are working as home healthcare workers, agricultural workers, meat processing, cleaning up in the hospitals, right? They don't have the protections because even though the laws are neutral and neutrally apply to everybody, right, there's always an exception to carve out the people who are poor, Black and brown, who are doing this work. And you can even see that in some of the COVID relief acts that have been passed that do not cover some of these workers. And so I think what we need to highlight is that law is so important, the political process and law, because it is often neutral, but it reinforces these systems and structures that keep people separate and down. And then what happens? We blame those people when the system gets exactly what it wants, which is to separate. The last thing I would say, I think two things is that one, I want to be clear that when we talk about racism, it doesn't just harm Black and brown people, it hurts everybody. And you can see that in the health research that shows as people come here, how their health deteriorates, whether that's Latino, whether that's Caribbean, whether that's white. Why? Because you cannot have equality, you cannot have racism and expect everybody to do well, because there's a burden placed on all of us. And so what I would hope that as we move to shift at this moment of COVID-19 to say we're going to change, that we do so together to understand that we are harmed all by racism and discrimination, and that if we work to change it, then we all will benefit from it.
I wanted to go back to something Dr. Smith said about this notion of a racialized imagination and this idea, and I can't remember which one of you mentioned this, but this notion of love. And it reminded me of what Dr. Sandra Galea, who's a dean of the School of Public Health at BU, has said, that he's given talks and he's written a variety of articles where he says, quote, "A world rooted in love embraces health as a public good." And that's always struck me, because I think people find that, love is kind of amorphous, or how do we root our public policy in love? And I'm just curious what that means, as opposed to something that's rooted in justice. Anybody can.
Well,
I'll jump in.
Go ahead,
Go ahead,
Dr.
Dr.
Ray. No.
I would just say, I guess in one respect, I don't think our society has been rooted in justice. So it's very hard to compare or shift to say it should be rooted in love. I don't think at any point we have said that we're going to be fair to poor people, Black people, Native Americans, Latinos. I mean, this nation was built on the backs of people who did not benefit from it. And so to me, if we are going to move to love, then that means that we value everybody who's a part and who is giving and providing in this nation. And I think the best example for me at this time is just looking at the millions of people out there working as essential workers, who we do not value, who we do not love, and who it's an injustice that we ask them to go to work without protective gear, without financial support. And so I would say if we're going to shift to that, then our actions need to speak to that.
Yeah, I would say You know, to be frank, Kayhan, I don't care about love. I don't want people's love. I want people's justice. I want the policy, because I think, you know, we have to start with the top up. I think a lot of times when we talk about love, and again, like Dr. Smith said, we're not talking about this in a romantic love, right? There's different kinds of love. There's a care, there's an empathy, there's a fairness, like Dr. Yearby said. And so when I think about that, to me, that seems very secondary. First, I want your justice. I want you to care about me in the legal sense. And we haven't even done that yet. Too much of our legal system is racist and has white supremacist tendencies. So first, I want that fixed. I want those policies and those regulations to legally care about my life, to be forced into it. I want policies and institutions like in the clinical setting, in the housing setting, in the banking setting, in the environmental setting, right? Those sectors give me justice. And then after you give me justice, then sure, we can talk about love. But right now, I don't care about it. I want justice. Give me policy.
And let me chime in on this. I think this is really important. And I actually would not necessarily disagree with the way Dr. Ray has framed this. What I would actually say is that sometimes in particular more reflection, people have pitted justice and love against one another. Whereas I think they need to come together in a particular way. And this could be my larger kind of religious social ethic coming through that's been informed by people like Martin Luther King Jr., by James Baldwin, some of his autobiographical essays. And so somebody like Cornel West would say that justice is just what love looks like in public, right? That these two things are so tightly woven together that only dealing with policy in a particular kind of way, we've seen that when we've had policy that's supposed to go to certain ends, that human beings are the kinds of entities, right, that are able to manipulate those policies in certain ways and do a workaround to those particular ends. And so there was this interesting essay that Martin Luther King Jr. wrote years ago. Not as many people have read it as opposed to some of his other kinds of works, but he talks about the ethical demands of integration and bringing together both this notion of, yes, we have to change the laws. I will continue to advocate for that for policy. We have to do it. We also have to begin to help other people see one another as people who have dignity and who have value. So it goes back to some of these points that Dr. Yearby was raising about all of us coming up together. That's one of the things I really loved about James Baldwin's writings, because one of the things that he would often remind us is that when we as people have to define ourselves as being over and against another group, that our worth and our value comes from being in opposition to someone else, that is unhealthy for us as people, because when those individuals continue to break those molds and those stereotypes, it creates a kind of an existential crisis in some ways that works itself out in policies that aren't beneficial for all. So in that sense, I do not want to hear much talk about love apart from justice. And it's one of the reasons why I talk about it as a political virtue that has to be integrally tied with with particular notions of justice, or else, like Dr. Ray, I don't think I want any part of it.
Dr. Williams, any thoughts on this?
Oh yeah, my definite. I can't believe I'm talking about love in a webinar, but my definition of love actually changed a couple years ago. I read a quote, and I can't remember the exact quote, but essentially, I think it was a Buddhist monk said, "You don't throw on that term love without really thinking about what that means." So the love you have for your child or your partner is different than saying, you know, I love lasagna. Which I do like lasagna, but you can't conflate like what love means by diminishing it, by removing the human connection, that humanistic aspect of that. And I agree that for justice, it is incumbent upon us to recognize everyone's shared humanity, and within that being showing love or admitting to loving your fellow man. And the way the policies and laws are done nowadays that are impacting marginalized communities, it is separate from that. In our minds, we have separated the two. Therefore, it is easy for us to continue to allow communities to suffer because that does not impact me. It does not affect me. I'm doing fine. We're seeing it play out in epic fashion with COVID right now. We see it playing out in gun violence. We see it playing out in the economic suffering of essential workers from this pandemic. But if we had love for our fellow human beings, if our leaders had shown that same sort of love, we cannot just write a $1 trillion check in the middle of a pandemic to be reactive to a crisis. We can invest a fraction of that in advance to ensure that everyone could have equal access to healthcare, equal access to pay, and not suffer the way they are now. That takes love.
So I have one more question, and then we're going to move on to a number of questions that have come through the Q&A. So I'm very much interested in this issue. I think you're alluding to, Dr. Williams, in the sense that we respond to issues in the world because we see them. And it's very easy in this kind of society that's highly segregated to not see a lot of things. And so the way that we represent ourselves, cultural representation, visual narrative, has a profound impact, I think, on the way we imagine the world. So for instance, it's clear that, based on the data, so many shows valorize the police, right? Cops are the good guys and they're out to get the bad guys. And no other profession is valorized like this. Not medicine, not nursing. And I'm just curious from you all, how do we create cultural representations that can powerfully affect people's minds and hearts in a way to see people as human beings, as opposed to, opposing forces or people oppressing others? Because I think that the way we imagine the world is the way we can create the world. And I think you use the word utopian. I don't have a problem with the word utopian. I think we need our imagination to create a utopian world. But the way that we do create these narratives, I think, has a great influence on the way we view the world. So I'm just kind of curious about your thoughts. Dr. Ray, do you want to take?
Sure. So if I make sure I got you correctly, so you're talking about these representations, these cultural representations of people,
Right.
and how do we make sure that once that they're positive, also accurate, and I think, is that what you're saying, Kayhan?
Yeah, right. That they're also kind of representative, and that they're richly textured, so that we don't have these kind of, again, these very superficial depictions of good police and bad people, but that, that the big. So I'm just kind of curious about how do we create a world that has these more richly textured, more nuanced, and more representative cultural representations?
Absolutely. So I think one thing to do, I'll give a little shout out to my medical humanities colleagues. And I think one thing that we can do is really make use of narratives, right? That we put people of color, we put women forward, and we let them tell their stories, right? It's too many times in academia, bioethics, and other disciplines, we're telling people stories, right? And when you tell people stories, you're telling it from your lens. No matter how hard you try to put the subject's view in up front, you're still telling their story through yours. And I found that in my work, what I try to do and what other bioethicists and medical humanities scholars try to do is let people tell their stories. And I think you get richer representations, right? You see this a lot happening right now. Every time I go on social media, I see these different groups that are trying to change the representation, say, of Black fatherhood, right? As going from this absentee person in the home to the actual statistics that say that they are very present in the home and do a lot of childcare and domestic work and that kind of thing. So once you start letting people tell their own stories, you start to see that it's not just these sort of cookie cutter representations that we see or that the media tries to tell us or that we may think of. But one, it also, we have to be willing to listen to the facts, right? Too many times we have these views of people, and if we actually look at the facts, we say, oh no, that's actually not accurate. So I think there's an openness to intellectualism that we have to have, an openness to storytelling, an openness to letting people tell their own stories, whether we agree or disagree. And then when it comes to police too, again, being open to the actual statistical information, being open to the actual storytelling. So that way it's not just, I want to think of these indigenous, Latinx, Black neighborhoods is bad and the cops is good, when there's some fluidity there, and there should be some openness in how we view each two of those groups. And again, it has to be an openness. We have to get out of just being so stuck in one narrative.
Thank you, Dr. Ray. So I'm getting the cue that we need to move on to questions. So we have a number of questions here. So I'm going to start off with this first question from our audience. When the Landmark Institute of Medicine report was published in 2003, it seemed to be a concerted effort to speak the language of health and healthcare disparities and shun the language of racism. We now seem to be centering the language of racism and structural racism. Let me pull it down. Did the IOM report set us back, or was it an appropriate strategy for its time? Does the language of racism advance the goal of social justice better? Professor Yearby.
Yeah, I know. I was responding to in the chat because I figured we have 41 questions. We're not going to be able to get to all of them. So thank you for this question from Mark, a former colleague. So what I said is that I think the IOM report was a great start, right? It did highlight these issues of racial discrimination that was embedded in our systems, in housing, employment, and in healthcare. It could have gone farther, but I think even what it did was not actually then translated into some of our social determinants of health goals. For me, as a former biologist, racism is always better, because when we use race, we try then to connect it to some biological difference or some genetic difference. And really it is about racism, right? And that goes back to Patrick Smith's points, right, about how it harms all of us when we have this misguided belief that somehow we are better than others. So I think racism should be grounded in the social determinants of health framework, but not just racism, right? When we look at those who are disabled, when we look at those who are gay, transsexual, bisexual, when we look at women, when we look at those who are poor, to me, this is just about hierarchy and discrimination. And to me, that's a better discussion than just trying to pinpoint some socially constructed thing to say, oh, it's because you have dark skin. No, it's because of how the system views me and treats me.
Let's move on to, so we won't be able to get to the 42 questions, but let me try to get a few more. Many institutions are doing implicit bias training, focusing on individual beliefs, attitudes, actions. I'm concerned with too much focus on individual behaviors as opposed to understanding and overturning systems of oppression. Any thoughts?
Oh, absolutely. Yeah, the implicit bias training, for one, so we all have our implicit biases. These are subconscious beliefs that influence our conscious actions. For example, if you're looking at an application for medical school and you see what is stereotypically a minority racial, like a Black sounding name, you may downgrade that application based on that. So that's your implicit bias playing out in how you will impact someone's future career. And we all have these. And understanding that is just a start. It's what you do with that information. It's like, okay, you know you have this implicit bias. What are you going to do with that? And in regards to training, the training has been shown to be most effective if it's proximate to some sort of event. So if you're on an admissions committee, you get implicit bias training just before you review all the applications. That is effective, as opposed to getting it once a year, 8 months prior to that. So it needs ongoing reinforcement for the implicit bias training. And then again, we're going to move on to the next step, which is really talking about systemic racism and structural racism within our, particularly when we have healthcare, but any large organization, any large system. So there's an individual responsibility, but also education to understand how structural issues are also impacting marginalized groups. So I've never personally been satisfied with just the implicit bias training without talking about how that impacts the other two.
Can I chime in, Kayhan?
Yeah, go ahead, please.
So just quickly, I know we have many questions. So I part of the question too, I think is really important to think about is the implicit bias training has its benefits, but if you have implicit bias training, but the culture at the institution that is holding the implicit bias training is not also anti-racist, then fixing the individuals will do nothing if you don't start from the top up and fixing the institution. So again, I don't want to be, be the broken record, but I want the policy to start at the top, and then I want the implicit training. That will mean even more, because you have to change the culture. You can't change the culture at a medical school or at a shoe store, anywhere that says we believe Black Lives Matter and we're going to give our employees this implicit bias training if they don't also institute policies that say not only do we believe it, but we support it and we're going to make it happen.
I think this next one, maybe Dr. Smith, you can address this one. This question says, Vanessa Northington Gamble, medical historian, former director of the National Bioethics Center at Tuskegee, and countless public health researchers have acknowledged that bioethics will make slow progress without the inclusion of the Black church. Now that the panel has established a multitude of ways that Black lives matter in bioethics, including in policing medicine, please comment on the role of the key cultural component, Black religion, and the Black church.
Yeah, thanks, Kayhan, for that question, and whoever asked that question here. That's, I think, a very important observation. Now, obviously, let me just go without, it should go without saying, but it needs to be said that Black spaces are very diverse, right? So you have a very strong, yes, religious and spiritual component, but also a very strong traditional Black humanist also who are emerging, and so there's no kind of monolithic way of thinking about it. But I do think it's still correct to say that the spirituality and the religiosity that's expressed oftentimes in Black church spaces is still something that plays a very important role in health and Black health and well-being of people who are in those traditions. And so some would suggest that there's this what's called like a priestly aspect, and then there's a prophetic aspect. Priestly aspect really deals with just spiritual issues, just helping you to withstand the onslaught of the psychological dynamics of white supremacy and all these kinds of things, that you have all these symbols and images that you are less than. The priestly aspect of this tradition is to help remind people of who they are and that they are not what others are saying they are, right, so to speak, and really giving them the resources. So for me, I had an uncle who was involved in the civil rights movement in Birmingham with Fred Shuttlesworth and King and many others, and it's very difficult for me to think about that movement getting any traction whatsoever apart from some type of spirituality that was helping them to stand up straight so that people could not ride their backs. Now, are these the only resources that can do that? Absolutely not. But this was a key component of wrestling with these issues. And so to the question, right, in terms of the role of kind of this Black cultural component of the Black church, I think you've got mechanisms of trust that are built in, and I will say for the record, right, as I've said in other spaces, that particular tradition has not always lived up to its ideals, right, in the way that it has often marginalized people within its community as well. But the best of that tradition brings with a kind of trust, a kind of solidarity. It also it puts things on the radar screen for bioethics to reimagine. In other words, centering things like justice, maybe as opposed to autonomy, taking seriously the larger social dynamics of our interconnected networks in ways that maybe other approaches to bioethics have not done, emphasizing the embodied aspect of our material lives, right, in ways that some aspects of bioethics have abstracted these philosophical principles in different ways. Probably more I could say, but I'll just kind of stop there to say that, yes, I do think there is a contribution that needs to be made from that sector, and also bioethics needs to engage those resources, even if they are not the only spaces where those resources can come from.
Next question, as a student in the healthcare field, physical therapy, what have you all seen or not seen from educational institutions that have addressed issues of structural racism in police? Follow-up, how can students use their position to advocate for changes in said institution? So you all are educators, you all teach students. I think this is a great question. What is your response? Dr. Williams?
Yeah, Kayhan, I will say that the students that I interact with now, where I'm at University of Chicago, but even all around the country when I travel, this generation is so much more socially aware and socially courageous about these issues of inequality, that I think it's a very exciting time to be an educator, to talk to them, hear their ideas about how to improve structures. I learn from them every single day, and I'm excited to see what will happen when they move into positions of leadership and start really working to reconstruct the structural racism that is impacting so many of the patients that we care for. So for a student, I think right now you're in a great time where you can actually speak out and feel welcome, feel heard, and actually make a difference. And I'm really honored to be around these group of students every chance I get, because it reminds me of how far things have come.
Next question. To what extent is the normative dimension of knowledge production, which Miranda Fricker links to epistemic injustice, an obstacle for creating a more racially diverse bioethics? Do we need new concepts and categories to fully combat structural racism? If so, what role do you see a globally diverse bioethics playing? Specifically, what's the relationship between sub-Saharan African bioethics and Black bioethics in the U.S.?
I can take the first part of the question.
Go ahead, Dr. Ray.
So what I think, I don't necessarily think that bioethics needs new principles, but I do think that we have to expand the way that we think about them, that they can't be narrow. If we talk about, the basic justice, autonomy, those kinds of things, right? It's not necessarily that those aren't appropriate anymore. There's still principles that I think are very much relevant, but I do think that sometimes bioethics and even other healthcare professionals too can sometimes think of justice as very narrow, or think of autonomy as very narrow, beneficence is very narrow. And so thinking about how these principles intersect with ethnicity, how they intersect with race, how they intersect with the social determinants of health. I think that's what we need to keep working on. When we talk about autonomy, thinking about what does autonomy mean for this particular group or for this particular nationality, right? Autonomy means so many different things for different cultures and backgrounds. And so I think that's where we have to sort of be a little bit more yielding.
And perhaps this is linked to this question that was just asked. Let me see if I can find it here. So the conversation so far has felt sociological more than anything. I would like to hear questions around the inherent Western paradigms present in bioethics. How is the field confronting the fact that bioethics is rooted in Western philosophy? So maybe Dr. Smith, you can respond to that.
Yeah, could you restate it again? Just to make sure I'm
yeah. Let me see if I can pull it up here. Just bear with me for a moment.
And Dr. Ray, if you were able to kind of get the thrust of the question, if you wanted to jump in as well, feel free.
Okay, yeah, it's towards the top, Kayhan, if you can. By anonymous viewer.
Yeah, I'm not seeing it.
You want me to read it?
Yeah, please go ahead.
Okay, so the conversation so far has felt sociological more than anything. I would like to uplift questions around the inherent Western paradigms present in bioethics. How is the field confronting the fact that bioethics is principled in Western philosophy? How do we fight systemic racism, the result of white supremacy, without the inclusion of non-Western philosophies?
Yeah, I'm not sure that we can, right? And it depends on what we mean in terms of like non-Western. I mean, there's a sense in which many of the resources that we draw from are going to come from a myriad of different sources, right? And so in that sense, there may not be a kind of a pure kind of line of when I think about the fact that as I read African-American philosophy, I have to acknowledge the fact that yes, there's an African dimension to that, but there's also an American dimension to that, right? In some ways that's unavoidable. And again, just to go back to James Baldwin, this is one of those lessons that he often taught us as well. But I do think these various perspectives of those who've been on the underside of how some of these philosophies, Western philosophies have actually played out, becomes a clue if you will, to give us some tools and resources to begin to dismantle the negative impact and the systemic structures that have been in place on some of these ways of thinking philosophically as well. I encourage students who are studying philosophy, they oftentimes read aloud political philosophy and moral philosophy. I encourage them, okay, we'll read the racist and misogynistic comments of a Kant and Locke and all these others to see that it's very difficult to disentangle these political philosophies from these underlying notions of white supremacy that are sometimes intermeshed with them, even if we don't understand it or realize it. And so I do think that other voices, other perspectives give us some clues, right, or gesture towards the kinds of resources we need to kind of undermine that. But if Dr. Ray or others want to jump in, I'll yield.
Yeah, no, I would just say, I think part of the problem too is that, as philosopher, just like Dr. Smith, we're not always trained in things other than Western philosophy. I know my own background is Western philosophy predominantly. And so I think too, we have to educate ourselves in order to help our students, or in order to even think about non-Western ideals and how that may better bioethics, and how they may better the way that we think about racism and white supremacy and police brutality, and even the health of the Black community. So I think there's a duty there too, and something to think about for philosophers themselves and bioethicists themselves.
So I'm looking at the time. We have about 10 minutes left. So I'm just reviewing questions here. Let me get to this question here. Recognizing that structural racism is deeply embedded in many institutions, including policing, how should bioethics, and really I think healthcare in general, engage in these issues? Should the focus be on reform efforts to bring about concrete, though incremental changes, or should the focus be on more fundamental social transformations, which might be harder to achieve? So this is something, I think this is kind of linked to the debate we've been hearing for the last couple of months about, abolish the police, defund the police, reform the police. And so I'm just curious what your thoughts are with regards to this issue. How can bioethics and healthcare professionals respond? Is incremental reform appropriate, or do we need more radical change?
I would say that we need both. I think it's important to begin to address it, to empower more communities and vulnerable individuals to be a part of it, meaning that they already have some of these answers and we have not been listening to them. And so we really need to begin to put them in places of power so that they can make the changes that they want to see in their community. I think that to me is the first part. But I think that we need some time in a sense of getting to utopia or to the place that we want, because we have been so harmed by structural racism that I think oftentimes we can't even imagine the things that we create. But does that mean that we need to stop? No, it just means that we need to work towards the things that we want to accomplish by having everybody's voice and empowering people, and whether that means in the police or whether that means in healthcare. I think right now, particularly in COVID-19, so much of the discussion has focused on the experts and not really listening to the people who are most impacted. Well, let me take that back. We haven't really listened to the experts, which is part of the problem, right? But we are not also listening to the communities, right, who are impacted, to the people who are working, who are living in close quarters. We are not listening to them. We are not providing them with the access they need. And so that could be one of the changes that we make.
Any other thoughts? Because I think this is really a big question for a lot of people. So Professor Yearby says both incremental and radical. What are the rest of your thoughts?
I like the way she put that we need incremental and radical change. But I think the even bigger issue was when she remarked about this, we were having an academic discussion, which is what we're really good at. We're good at getting experts together to have this discussion about police who are not involved in this panel. We're talking about marginalized communities who are not involved in this panel. So we were very good at studying the communities, talking about the communities. But in the end, is there been any real sustainable change based on what we have done? So we need to widen that tent. Instead of saying, here's the answers we have for you, bring people to the table and say, okay, this is your real experience. What are the problems that you see, and how can we be a part of the solution? And that is something that those of us that are in academics with the experience, expertise, need to step outside of our professional titles and make those sort of connections and long-lasting contributions that can have sustainable intergenerational change, or else we'll keep repeating the cycle over and over again.
This is why the emphasis that many have been writing about in terms of communities being involved in bioethics, and bioethics engaging particular communities become extremely important, just to underscore these comments of Dr. Yearby and Dr. Williams.
Dr. Ray, did you have anything to add to this?
I'll just briefly say that I think how bioethics thinks about white supremacy should be the same way that we think about anything that jeopardizes humanity. As I said, early on, if we think of racism, white supremacy in a way that jeopardizes the very principles that we hold dear, then we would see it as something that's worth our action. And we have to look to our governing bodies to take stances, and for us to support those stances and to actually do action, right? Go out and participate in advocacy, go out and write for people other than academics, but write for the general public, right? If we're going to be champions of intellectualism and champions of change, then we have to step outside of this ivory tower, like Dr. Williams said, and see that these bigger threats of white supremacy as in the same way that we would see anything that threatened human life.
So we have just a few minutes, and maybe we can just build on this question, because from what I'm hearing from all of you is an expanded role for academics, whether it's academic ethicists, academic physicians, legal academics, philosophers, to engage more deeply and less superficially. And I think you hinted at this, Dr. Ray, with regard to what does an activist academic look like? What does that look like? So we can bring on, I mean, you mentioned about writing for a broader audience, but we're trained to look at things. I mean, like Dr. Williams said, we're good at studying issues and analyzing issues and talking about issues. But what is our professional role beyond that? And perhaps
right.
we'll leave it at that.
Yeah, I think too, part of this is a training, right? We can say, yes, we haven't been trained in advocacy, right? I don't know about you, but that was not a part of my bioethics education, right? But it's something that we can come to. And now that we are aware that this needs to be a part of our role, now we influence the generations that come after us. At the McGovern Medical School, whenever I have my classes about race, that question always comes up amongst my students. Now, what can I do as a medical student? We talk about advocacy, we talk about institutional changes, because I'm very big on, you can start one where you are, change your institution, and then work for broader change. And so I think we need to start being, and looking to people who have been advocates and look to them for guidance, let them lead the way and let us give them support.
I think for me, just to jump in, one of the papers that I always go to in terms of bias in the healthcare system was a doctor who amplified the experiences of his patients, right? And so as an activist scholar, what I try to do is amplify the voices of the people in the community, because I feel then people will listen and respect that. And so I consider myself as an academic activist because that's what I try to do. But I think that's what we can do in bioethics and medicine and other fields. And I say in the police, what has been great is that they are amplifying, right, the voices of the communities and the disempowered to say enough is enough. So I think that's one of the ways that we can start.
Williams, Dr. Smith, any final thoughts about how we as academics can engage and see more fruitful and deeper change?
Sure, I believe academics are in a perfect position to be activists. And first we have to define what activism means to us as an individual. And I've always figured that if you do something that will invite backlash by what you say or do or for which you advocate, that makes you an activist. So this panel today, having a bioethics discussion about police brutality and racism, that could be a form of activism, right? You can write op-eds for non-academic journals. You can write a paper about racism for an academic journal, which one of the major academic journals, medical academic journals on the planet, as of a couple of years ago, only had mentioned racism about 24 times in their entire history. So things like that push the conversation and can lead to potential personal and professional repercussions where you will possibly lose more than you will gain by your success. That to me is activism, and you can define that for yourself. So just do you, what makes you feel comfortable.
Now,
Smith, I'm going to give you the last word here.
Yep, absolutely. My uncle used to say something to me when we would meet before he died. He would travel sometimes, we would sit down, and he would ask what I'm doing, what I'm working on. I'll give him all the academic stuff I'm doing. Then he'll say something like, he'll just pause and look at me kind of unimpressed and say, just don't forget about the people, right? Don't forget about the people. And this was something that had stuck with me. And to use an academic trope, right? This notion of an organic intellectual, a person who is, yes, cultivating the life of the mind, but embedded in particular communities, in the life of that community, whose research questions emerge from the particular needs of that community, and bring these things together, I think is a form of activism, and something that many of us who are doing this kind of work can certainly be a part of.
I think I'm going to leave it there. I want to thank you all so much for, I think, a wonderful conversation. Dr. Patrick Smith, Dr. Keisha Ray, Professor Ruqaiijah Yearby, and Dr. Brian Williams. All of you have been wonderful. Appreciate all of your insights and your knowledge and your wisdom. Thank you all for joining us. It looked like at one time we had well over 500 attendees. So thank you all for joining us today. And this is being recorded, and the recording will be made available on bioethics.net. So wanted to thank you once again.